With so many stories like these on the news, we knew that the doctors should start investigating some of the biggest health stories to bring you the facts. You just saw Melanie Woodrow, our new investigative reporter, who's here with us now. Welcome to the team, Melanie.
Thanks so much, Travis. Really excited to be here.
We're really happy to have you here because there are so many stories. We hear about them. We don't know how to react. And I think that's what we want to do as part of these investigations. This one in particular troubles me because if you all look up here, can you tell me any noticeable difference between these 4 different bowls? What if I told you these are all candies, and then these are these little balls we were talking about in the story? These are made of a polymer, much like you might find in a diaper. It's meant to absorb water. The packaging says it can grow to 400 times the size of this. So we had these, Melanie, soak for a couple days.
Exactly.
And imagine a small child swallows it. Of course, what's in your body? Water. And then over time, this can grow much like it did in Andrea's case, causing severe problems.
And you probably know better than anybody else, doctors are taught that if a child swallows something, eventually it will pass. But what is really interesting about this product is that unlike something else that would pass through the body, as it moves through the body, it grows and it gets stuck. And here's something else. The surgeon in the story told me that this ball did not show up on a regular X-ray.
Well, this ball right here, let's use this as an example. You can barely see this, let alone on an X-ray. There's no way this is going to show up. And so a child comes in with non-specific abdominal symptoms. You may not know what's going on, and certainly if you haven't heard about this story, a parent may not know that their child just ate one of these. Now, I do have to ask, how is Andrea doing now?
She's doing okay. She's almost 2 years old, no long-term complications, but obviously this was really scary for her family, and it could have turned out differently.
What I think about here as a doctor is I'm trying to figure out, how do we stop something like this from happening? Because certainly, I don't think the company that makes these had any intention for bad things to happen. I don't think that's the case here. So the question then becomes, how do you prevent this from happening?
Well, it's really interesting. The toy manufacturer's CEO told me that this is an educational toy. The idea being that a child could put this in water, see how it grows, and it's really meant for older children. So according to that person, it's really the responsibility is up to the parents. However, the parents feel that it's up to the toy manufacturer to more properly label their product and to put a warning on there.
And in fairness, the product does mention on the packaging, not suitable for children under 36 months. And another part of the package says, warning, choking hazard, small parts. Again, not for children under 3 years. Parents, you have to read these packages. And the official statement from the Consumer Product Safety Commission is this: CPSC is committed to protecting children from known hazards and hidden hazards with consumer products, including ingestion hazards with toys. And before we close out this segment, I'm just going to use a little side-by-side example here. Can you all tell any noticeable difference? And if I asked you all in the front row, if I mix these up, in the front row, because you're the closest, who thinks this is the candy? Half of you. Who thinks this is the candy? Half of you. You just don't know. And that's where the problem is. So what we would have to do is urge parents, never buy things that kids are going to put in their mouth and potentially cause harm. And we see a lot of this in the emergency departments. And it's not always candies like this or toys like this that look like candy, but it's other things. It's button batteries. It's all these things that can cause damage to your children's intestines. Melanie, thank you so very much for this report. And it's so very important to always read the label on children's toys. Take precautions when your child is around any type of small object.